When you're fed up with fighting food and your body, join us here. I'm Ali Shapiro, creator of the Truce with Food program and your host for Insatiable, where we explore the hidden aspects of fighting our food, our weight, and our bodies, and dive deep into nutrition science and true whole health. Fair warning, this is not your parents' health care. This is a big rebel yell to those who crave meaning, hunger for truth, and whose lust for life is truly insatiable. Believe me, freedom awaits. Welcome, everybody, to Season 9 of the Insatiable podcast. Today, we're on Episode 7 with Kristy Rodriguez. Our season theme is fertility. This topic often gets reduced to periods or pregnancy without regard to the physical, emotional, and soul process involved with our hormones, menstrual cycles, bodies, and identities, regardless if we choose to have children or not. In this season, we will take a holistic and integrated look at fertility to reveal you have more choices than most of us have been led to believe. Being in my 8th month of pregnancy at the time of this recording, I'm now surprised I thought that Western medicine would be authoritative on fertility. It is just as fraught with fear tactics, outdated science, and siloed thinking as nutrition, weight loss, and wellness. My hope is we fill in the gap you might not know you are missing, have better questions to ask, and are able to get the results you want on your terms for your period, hormonal health, conception, pregnancy, birth, and the 4th trimester and beyond. This fertility theme is also the theme of our Insatiable membership community. We will spend the fall, September, October, and November, taking a deep dive into the physical, emotional, and soul aspects of fertility for your current life stage, whether you're menstruating, perimenopause, or postmenopause, and how to sync our nutrition, lifestyle, and creativity to be in sync with our fertility, to reduce and prevent cravings and live life on fire. More details on how to join at alishapiro.com/IC2019. So on to today's episode, What No One Tells You About Birth with Kristy Rodriguez. Kristy is a mom, hypnobirthing, childbirth educator, certified holistic health coach, registered prenatal yoga instructor, and author of Pure Nurture, a holistic guide to a healthy baby, and host of the Pure Nurture podcast. Kristy specializes in prenatal and postpartum wellness, advocacy, and empowerment. With her accumulated years of experience in education and health, she brings extensive knowledge, personal experience, and deep compassion to her students, both in person and online. And she's also a mom of 2. Welcome, Kristy.
Thank you, Ali. I'm so happy to be here.
Yes. Full disclosure, we're friends, everyone. So we may have a more informal banter, right?
Yes. I know we've already been chatting for 20 minutes already.
Yeah. So Kristy, I want to start with, you have such a wide variety of a holistic health background. Why did you decide to focus on healthy babies and families?
You know, it's not what I thought I'd be doing. I actually didn't even know if I wanted to be a mom. So I remember I would walk around the bookstore and I would have this physical aversion to the pregnancy and childbirth section. I don't know why, but I just couldn't ever get myself there. And then one day I realized, I'm getting older. I don't know. Do I want to have kids? And I started thinking about it as a 50 or 60-year-old. And I thought, do I want to have kids in my life as a 50 or 60-year-old? And I thought, you know what? I think I do. And then my husband was like, I really want kids. And we had that whole conversation. And so we decided to go for it. And it was during my pregnancy with my oldest daughter that it just started to blossom, this interest in healthy babies. Now, I had been a health coach prior to that. And I had also been by my dad's side as he went through treatment for colon cancer. And so I had this previous experience of Western medicine and what my dad went through and how he was being treated and kind of the parts that I felt were missing. And then from there went back to school to become a health coach and started working with clients. And so all of that kind of came together. And then in my own personal experience with pregnancy, it just all came together and this passion just grew from there. And I thought maybe I'm just interested in this because I'm pregnant right now and that's why I care about it and it'll fade away. But it didn't. It kept growing. And then I got pregnant again with my youngest daughter. And that's when I decided I was going to go all in, and I wrote my book, and I went back to school again and got all kinds of extra education around pregnancy wellness. And it's just been growing from there.
I love that. I feel like most people who end up with these passions, like I feel like out there, it's like, find your passion. Meanwhile, it's like often you just stumble into it.
You
Like
stumble into it.
it's not something that you can go out and seek. And I was very much the same way as you. Was like, do I want to be a mom? And I realized that so much of what I was afraid of, at least what I'm experiencing, again, I'm only, I'm almost rounding into the 9th month here, and obviously have not officially become like a mom yet. But I've just been shocked at how much of my fear is based in this fear-based culture we have around birth. Like, I was like, if someone's going to die in childbirth, it's going to be me, right? And it's like, and I was convinced that that was like a legit belief I had until I realized how much of that was just kind of an all or nothing way of not understanding that our birth culture is really fear-based.
It is.
And belief-based versus evidence-based care. So I want to kind of kick off and talk about that, because I think when someone goes, if they're planning prenatal, preconception, or even birth, you kind of, the standard is to go into a hospital and assume what they're doing is all research-based. And what I've discovered is it's a very far cry from that. So can you talk a little bit about evidence-based care versus norms that
Yes.
to be done?
And I think I want to go back to what you said about this fear-based culture that we live in, especially around pregnancy and birth. And if you think about what we've seen on TV and what we see in the movies and stories that we've heard, it is very, very fear-based. I mean, it is just, you see people screaming. I always think about Rachel on Friends. For some reason, that was like fried into my brain, like her face and just screaming. And so that's what we grow to expect. And then within that, when you think about, many of us give birth in a hospital setting. And what do you think about when you go to the hospital? Hospital is where you go when you're sick. But when we're pregnant, we're not sick. There's nothing wrong. But we go in, we put on the hospital gown, and on some subconscious level, it makes you feel like you need something, you need help. Something's wrong with you and you need help, versus this other way of thinking about birth in a more empowered way. And then really learning about the physiology of birth, and that our bodies were designed to do this. And you can look back in history about how women have given birth for years and years and years. And it really is empowering when you look at it from that perspective. And I went into my first birth very fearful as well. I again didn't know anything, just as many people who get pregnant. Many times we get pregnant unexpectedly. And so we just start to learn a little bit about pregnancy and birth right as we're in those beginning stages of pregnancy. And that was my experience as well. And I gave birth in a hospital and just learned a lot. And I had my experience of a hospital setting with my dad. And it was fascinating, the parallels that I could draw between his cancer treatment and then the way that I was being cared for. I'm trying to think of a better way of saying that, but essentially cared for in a more westernized setting with the testing and, no talk of nutrition at all. No talk about the physical aspect of birthing, different positions that you could be in. Many times what we see on TV and what's done in hospitals is that we give birth lying down. But when you think about it and you think about gravity and you look back thousands of years of how women gave birth, that's not the most supportive way to give birth. It kind of goes against what physiologically is happening. So I think that there's a lot of room for women to learn more from an empowered place, and then also from an evidence-based place where you learn about what actually can be supportive of you and how you can work with nature to support your body in the birthing process, especially thinking about the mind-body connection, which is something I'm really passionate about. And a lot of times in our culture, everything we do is we think about it, we process it, we contemplate everything. But when it comes to birth, it is a physiological body process. And if we can get the mind out of the way and just let our body and our baby work together, we can have a much more empowered experience. And yeah, I'll just stop there. I feel like I've said a lot there.
No, and I want to get to the mind-body connection because there's so much evidence around if we really understand the physiology. And just for everyone listening, I know a lot about health. I've recovered my health time and time again. I feel like I'm an empowered patient. I feel like I'm a negotiator with all my healthcare practitioners. And I have been floored at how much I had internalized this fear-based culture around pregnancy. So I just want to kind of plug for everyone, really what Kristy's talking about, learning your physiology and how labor works, has been amazing for me just to understand that, oh my God, this is how the body works. And this is not something to be afraid of. Because what I think it's hard to grasp until maybe you're in it is, to your point, Kristy, fear-based versus this is a natural process. Hospitals, and I mean, this is a whole other thing. Yes, people have become more litigious, like all this stuff, but they are coming from a fear-based insurance lens. How do we mitigate risk? Which is very different questions than how do we support the most healthy pregnancy. And I'm not saying one is right or wrong, right? You kind of have to equal both. But when you have neither of the, how do you support a healthy birth, like with nutrition or teaching women how their bodies work or giving them options of how they want to deliver or some other things of like, the labor should take 24 hours. That's not evidence-based, right, Kristy? It's like, no, that it's like labor takes what it's going to take. And so it's really important that you understand what is, quote, normal compared to what is coming from a fear-based place.
Right. Well, and one other aspect of that I was reminded of when you were talking was also this fear-based place, but also our culture is very fast-paced. We want everything. We want immediate gratification, and everything is speeding up. Even our internet access is speeding up. Everything is speeding up. And so it makes sense that we would want our births to we'd want to go in and birth our babies. And, people get excited about having a 3 or 4 hour birth. That's like, oh my gosh, it's amazing. But you know what? Birth can be 20 hours, 30 hours, 40 hours. I mean, our bodies, there are some women that can be in labor, not even know it for a week. I mean, and there's nothing wrong with that. And I think it's very important to realize that as well, and to not make it wrong and feel like we have to intervene because everything's going so slowly. Now, I do also want to make sure that I'm very clear that if a medical intervention is necessary, thank goodness we have that. Medical interventions save lives. But I think that there is a time and a place for them. And there's also time and place where they're not needed. And we can give our bodies and our babies time and space and let it unfold naturally. And I know sometimes that's hard though. We want things to go quick. We want to be, we want to have it done, have our babies in our arms, and that makes sense. But sometimes nature takes its time. It's just like the seasons. We wouldn't rush spring to happen. We can't go over and pull the flowers out of the ground because we want them to blossom more quickly. We have to let nature take its time.
Yeah, I mean, I'm someone who was like, okay, I just hope it's a quick labor. And then as I've learned more about the physiology and realizing that I'm hoping for an unmedicated birth at the birth center, obviously it's a preference. You can't control everything. But it was interesting to read that often shorter labors are more intense with pain because of all the work that the cervix and uterus are doing, right? And it doesn't mean it's right or wrong, but I've totally flipped like, wow, knowing my personality, I do better if I can pace myself. So now I'm like, wow, I hope to get a birth that allows me to pace myself and the contractions and stuff like that. It's just interesting how the more you learn, the more your ideas shift and change.
I was also thinking about, we hear these different stories and then we think about our own story and, like you were saying, what you hope to have happen or what you feel like you could do or not do. And, just my own experiences, I had the opposite with my first. It was a very long and, I definitely had more sensations. And my second was, I think, around 5 hours and much more calm and relaxed. And so I didn't have that experience where, because it was shorter, it was more intense. It was less intense, even though it was shorter.
I want to order that.
Yes. Keep affirming that. So you just keep affirming that, playing it out in your mind, all of that good stuff. Just keep thinking about it.
Yeah, yeah. So yeah, and I just want to make a plug for this one website that I really loved. If you're really into learning evidence-based, there's a site called evidencebasedbirth.com, and it's really fascinating to look at all the meta studies and everything. So you were talking about mind-body connection, and part of also what I really hope people do is start to, again, look at evidence-based care, because let me just circle back. One of the things, to your point, yes, if you need a medical intervention and it saves your life, I mean, we're all for that, right? It's like I always tell my clients, there's a right tool at a right time, right? Mm-hmm. Nothing's bad or good. It's just like what tool at what time. And it's really important to learn that a lot of interventions done in a hospital cause more interventions. And I think that's really important to educate yourself on, because if you're someone who doesn't want a lot of intervention, it's important to know that. And it's also important to know that you might not know what you want until you start researching. And the reason that I bring that up is if we start to think about the qualities of a satisfying birth experience, and these are based on research, what they have found that women find a very satisfying birth experience if their personal expectations were met. Okay, so you are the one in the driving seat choosing what you want. The amount of support they got to carry those out, the quality of the caregiver, right? Did this person listen to them, support them? And if the mother was involved as a decision maker in these processes. So basically, what they're saying is if the woman got what she wanted, including changing what she wanted as the birth progressed, right? Because you can't just have a plan and expect nothing to change. But I think that's really important for people to realize. Many people might think, a satisfying birth experience is the least amount of pain for everyone. And that may be yours. There's nothing wrong with that. But starting to do the research so that you can really know what your choices are around induction, around pain management, all of these type of things will help you feel like you're in choice. And that's how we know people get the most satisfying birth experience. It's not what they choose, it's that it is genuinely their choice. So can you talk a little, I want to talk more about that with you, Kristy,
Yes.
But I just wanted to kind of frame that, because I, again, always thought, the most satisfying births are the least painful. And then the more I've read about this, the more I'm like, there's so many other things to decide between.
Absolutely. There's so many things that can influence how somebody feels, and looking back on their own experience, how they're going to feel about how their experience unfolded. And I think about two key things. And one you mentioned, one is your support team, your birth companion, your care providers, your family, anybody that's there to support you physically, mentally, and emotionally. That is so key to how you experience your birthing. And also what you had mentioned is that decision-making process, that you're involved, you're being informed, you're never feeling like you're being pushed into a corner about anything related to your experience, and that you are part of the decision-making process along the way. Even if it is a medical intervention that is medically necessary, you are still being told what's happening, and you're part of the decision-making process, the risks and benefits, and there's informed consent. I think that that's key. I hear about different people's birth stories, and it's really important to realize that, a woman that has a C-section, that could be a traumatic birth for her. And yet somebody else could have a C-section that is the most empowered and calm birthing experience. And it's about your perception of it, how involved you are in the decision-making process around each step along the way, that has so much to do with how you experience your birthing. And, and same thing, you could want to have a home birth, and somebody could have the most calm and peaceful and wonderful home birth. And then somebody could have the opposite experience. It doesn't matter where you give birth, how you give birth, but so much around who is there to support you, how involved are you in the decision-making process, how empowered do you feel, how supported are you? And I think those are two key aspects. And something else, we were talking about, evidence-based birth and interventions, and something I wanted to make sure I got in there, because I think this is one of the things that because you'll talk about your due date with strangers on the street. And so I really want to make sure that I get this in there about our due date, because we have this belief that 40 weeks and you're due. And if you are a day after, everyone's like, oh, your baby's late. Oh, your baby's being stubborn. Oh, all this language around being late or being early. And I think that it's something that we all really I feel like we all need to get around and rally around talking about our due time or our due month versus hyper focusing on our due date, because it really is an estimated due date. And for some reason, that the estimated part, gets dropped off and nobody ever calls it an estimated due date. But it is literally an estimated due date, and it is arbitrarily set at 40 weeks. But really, our time of gestation is 265 days to 300 days. So if you do the math, it's a 35-day window. And the way that they do it is they divide the 35 by 2, which takes you to 17.5 days. And then they add that to 265 days, which is the lower number of the range. Then they divide it by 7 days in a week, which gets you about 40.3 plus weeks. And that's just about that's about how scientific as the estimate is. So I think it's super, super important for everyone to really understand where that number comes from. It is not this set in stone date that we all need to obsess over. It is a range. And it really helps. I think it would really help women to relax, feel more confident and comfortable in the process of when their baby comes, and not feel this pressure about that date. And that also goes into meeting with your care provider. If you meet with your care provider around your 40-week mark, a lot of times they will want to schedule an induction, and you can feel more empowered to go in there and say to them, am I healthy? Is everything okay? Is baby okay? Is baby healthy? And if they say, yeah, there's no problem, we just want to get you scheduled so we have it on the schedule just to make sure we've got that. And you can say, no, thank you. I'd rather wait a little bit longer. Can I talk with my partner about that a little bit? Or can I think about it a little bit more before you feel like you've got to do it? Because like you had said, Allie, and it's true, one intervention can lead to a cascade of more interventions. So if you're a person that wants to have an intervention-free birth, a more natural birth, then that's something that you want to, think about, and maybe avoid having an induction and let your body and baby kind of set the pace if possible.
I love that you said that, because I think it's so important. It's kind of a great kickoff of now we can go down, like knowing that's a choice you have. And I can share like personally, so I will be 41 when I deliver. And I actually chose the Midwife Center here in Pittsburgh because they are much more, they view you as a client, someone who knows your body, and you can make choices. And at the beginning, they told me, we're going to show you our research and then you can always decide. But they were saying, like, because you're over 40, we will want to induce you at 39 weeks. And I remember at the beginning of this, I was like, oh, why? And they were like, well, placenta health, et cetera. And I was like, okay. And I was thinking that I would do it. And this was at the beginning. But then I was like, I don't understand why, like, the midwives tend to trust the body, trust the birth experience, but then all of a sudden we don't trust the body at 39 weeks, whatever. And now with all the research I've done, I will do a non-stress test, right? Like do the test to make sure everybody's healthy. But I feel so much more empowered to say, no, I don't want that. And I know I'm considered high risk because of my age, but everything else is super healthy. And so that's an example for everyone listening of like a choice you might not know that you have. And one of the things that I think is a really great question that I've been taught to ask, and Kristy, you can, confirm or deny this, but is whenever you are in labor or throughout any test, you can ask, is this medically necessary? And then you'll get a different kind of answer rather than this is just how it's been done. And one thing I've also learned is that, like, because of the movies, you think everything's moving so fast, but you can slow down you do have time to make decisions, maybe some less time when you're in active labor. However, you still have that time. So asking, is this medically necessary, is a really great way to get an understanding of what's happening.
Yeah, no, absolutely. That's what I tell all of my hypnobirthing students is anytime something is introduced or suggested, always ask, is it medically necessary? Is mom okay? Is baby okay? Can we please have some time to think about it?
Yeah. So let's go from there. So what tends to happen, and I want to get into pain management after this. So there are so many different ways to manage pain and everything. And what's important to realize is that often if you are induced, whether it's a natural induction, there's all sorts of natural ways that more natural ways than there's Pitocin at the hospital. But something that has been really eye-opening to me is if you do Pitocin, the contractions are more painful. So people tend to think that if you're going for what I'm calling an unmedicated birth, that if you're getting medication, you're not going to be in any pain. And that's not necessarily true. So if you do get induced, especially if it's with Pitocin, or even I've heard people who do castor oil who have done natural, and I know that's not recommended in the hypnobirthing community, but those brought on really painful contractions. So it's important to realize what we've been talking about with interventions, that it can lead to, that's often why people need an epidural, because they're experiencing Pitocin contractions rather than what the uterus might do on its own. Pitocin basically overstimulates, or it's a natural form of oxytocin, right? Kristy, this is...
Yeah, it's an artificial form of oxytocin. And so, so what happens is when you are induced with Pitocin, it's bringing on the contractions. They're more intense because then your body is not... So when the natural hormones are flowing through your body and it's creating the contractions, which are helping to open everything up and help bring your baby down, there's also a flood of these feel-good hormones that then work as a natural pain reliever. And so, oxytocin has been said to be sometimes as effective, if not more effective, than morphine at times when you have high levels of oxytocin. And that's what we talk about in hypnobirthing a lot, is how else can we get these oxytocin levels up and these feel-good hormones flowing? And, and I can go into some of those things that we do to help bring up more of those feel-good hormones, because when the feel-good hormones are surging, the catecholamines and the other kind of restricted hormones that cause the pain are then being relieved. And so you're not experiencing the intense, we call them surges in hypnobirthing, those intense contractions or surges that are then being induced by the Pitocin. Now, you don't have any of the feel-good hormones surging to counteract that. And so that's another reason why that having the Pitocin is more intense.
Yeah, that's a great way of putting it. Again, it's not bad or good. It's just, I feel like it's controversial anymore to say pros and cons. Like everyone gets offended.
I had a woman get very upset about the term natural birth. She said all birth is natural. And so ever since I had that conversation, now I'm always a little bit hesitant to even call it natural birth. And I tend to say intervention-free birth more often now, because of that, and which that comment can be controversial as well. We all have our own opinions about things. And I mean, that's fine. We all have our way of talking about things and opinions about things. But
yeah. And that's why it's like, I know, I was actually texting with a friend because she had hashtag natural childbirth, and I DM'd her and I said, did you have an unmedicated birth? I'm curious about your experience. And she said, well, I did have an epidural, and, I think all birth is natural. And I'm like, that's great. I'm like, that's why I asked how you're defining it. And she was like, yeah, right. And so again, this is why I think it's so important to like really educate yourself and understand there are pros and cons to everything. I mean, and that's just life. There's no right or wrong answer. There's pros and cons. So, not being induced naturally is going to, if you're not going to use medication, you're probably going to feel more pain than with an epidural. That's a con, but again, really educating yourself and looking at the risks of interventions and a certain path, what will help you decide what's right for you, because we know what you think is best is probably, because of the placebo effect, has the best chance of working.
That's right. It's so much about that mind-body connection. It's so much about what you believe to be true.
Yes. And so let's talk a little bit about various choices for pain management. I'd love you to just even define hypnobirthing, because I know that's the childbirth class we took. I didn't understand I did not know that the premise was pain, no pain. And I'm still not expecting that, but can you explain?
Yes.
It teaches a lot about the mind-body connection in terms of how we make meaning from pain, which I think, especially my clients who've gone through Truths with Food and Why I'm Doing This Now, so much of healing work is about the meaning we make from things. So I find this topic fascinating.
Yeah, it's so much about that mind-body connection and our belief systems and how powerful our thoughts are and our mind is over our physical experience that we have in our body. And it's the placebo effect. That's the whole premise behind the placebo effect. It's because your mind is creating your experience, whatever is happening in your body. And so that is one of the foundational teachings of hypnobirthing, is that we don't want to focus on pain, because the more we focus on pain, the more we're thinking about pain. And then ultimately, the more we will experience pain, because pain creates tension in the body, and then tension creates pain. So we focus a lot on comfort level. It depends on the hypnobirthing teacher, and some will not even allow pain to even be a conversation or even be part of it or brought up. I feel that partially that does a bit of a disservice, because then if a mother goes into her birthing experience and experiences pain, she may feel that she has failed at hypnobirthing. And I do not think that that's the case. I experienced sensations, intense sensations at times during my second birth, which I did hypnobirthing. That's what got me into even being involved in hypnobirthing, was my own experience of it. And I think that that's first and foremost, is that we want the mind to focus on what we can do, what we do want, versus what we don't want. And so a lot of times in hospitals, they'll come in and say, okay, tell us what your pain level is on a scale from 1 to 10. And so again, that gets all the birthing people thinking about pain. And so we want to talk about, what's your comfort level? It first starts with changing the language around birth. If you think about the word contraction, what does that make you think of? Tension, contraction, tightness. And rather than using the word contraction, you can call it, in hypnobirthing, we call it a birthing wave, because it is literally a wave of sensation that comes and then goes. You can also call it a surge. And so just changing the language really helps to change that mental perspective of what you're going to experience, and then ultimately is going to have an impact on the actual experience that you're having in your body. So we start with that. And then we talk about the different tools that you can use to help. One, I talked about when I was talking about Pitocin, and talked about oxytocin and how powerful that is as a pain reliever. Well, we want to increase the oxytocin. So how do you do that? You laugh, you feel good, you do things that feel good. Also, we talk about what got the baby in can help get the baby out. So we talk about stimulation, nipple stimulation, clitoral stimulation. We do a type of massage that helps to bring this tingling, feel-good sensation over the mom's body. And lots of different physical techniques that you can do to increase that feel-good hormone, the feel-good hormones that help to reduce pain. We also talk about breathing techniques, lots of specific breathing techniques to help keep the body calm. As I had said before about, the tension, pain, it's like a cyclical thing that happens, that fear, tension, pain response. Well, we want to keep the fear and tension at bay. So we want to use affirmations. We want to use visualizations and breathing techniques to keep our tension low, to focus on what we want, visualizing that 4-hour birth, visualizing calm settings like a peaceful forest or whatever you can do, listening to calm music, anything that you can do to keep your body out of that fight or flight mode. We want to keep our nervous system in that calm, relaxed, resting mode. And so we use all these different tools to keep the body resting and relaxed as possible.
You said so much good stuff. I mean, I think, first of all, I love that in hypnobirthing, there's a completely different language. And the idea for everyone, when you start to learn the physiology, you realize that the wave is also opening your body up. Your baby's getting closer, right? Mm-hmm. Versus when you think of contractions, I almost, like if you don't know why the pain is happening, a lot of people think they're dying or like that they're in pain, like that, again, that the pain is something bad. And when you learn that, oh no, this is my body opening. This is the cervix pulling back so that the baby's head can start to crown. It's just like, again, the pain takes on a different meaning. And I love that idea of a wave. I mean, even that language I learned, I'm such a catastrophe. I've learned how much of a catastrophizer I am during this. I assumed that like waves, I figured you were like in pain for an hour at a time. And they're like, no, kind of increases. You might at the peak, be 15 seconds sometimes of really intense sensations. And then it waves back, like it crashes.
Yeah. And then it's gone. And you're just there waiting and resting and doing whatever you want to do. And then, here comes another one. And then you manage it, and it only lasts for a minute or less or more. And you deal with it in the moment, and then it's gone.
So imagine, listener, right, that like I'm someone who's very goal oriented and I like structure. I'm like, if I know that I can get through just this wave, right, one wave at a time, and it's going to be a minute or it's going to be 15 seconds, or rather than this whole time, all of a sudden, and I know that that's forcing my body to open, right? I mean, it's helping my body to open. It has a different meaning than what's going on. Why is this so painful? And that brings, to your point, that brings more of the stress hormones online. And so that's just a small example, but of how what Kristy's explaining is that we can influence the perception of pain and physiologically as well, not just mentally. I was laughing because our hypnobirthing instructor was, again, I had no idea that the premise was like pain-free. And she was giving us these examples of like, this one woman like basically fell asleep and then just like woke up and her baby was like coming out. And then another woman had an orgasm during it. And then, one woman had a 2-hour birth. And so like when she started giving us all these breathing instructions, I'm like, how are we going to fit all of this in and orgasm, and we just like all kind of started laughing because I'm like, I don't want people walking away thinking that's the expectation, but you just never know. And the more you can be relaxed in terms of expecting those sensations, the pain management gets really different than, again, there is the choice for the epidural. And what I found really interesting about the research of the epidural is, again, often if you get that, then you can't stand or get in different positions, which will help the pain. So that's what I'm saying for listeners is like, realize once you get one thing, it might limit other choices. And as someone who like loves freedom and choices, I think that helps my mind-body connection, knowing that certain choices give me more choices because I don't like to be boxed in or close anything off. So know yourself, right? If you're
exactly. You might not care.
Like that and wants a strict plan, go the other way.
Right. Yeah. I mean, some women, they want the epidural. They just want to lay down. They want somebody to tell them what to do. They don't want to feel anything and they want it over with as quick as possible. And that's great. There's nothing wrong with it. That is the birth experience that they want to have. And other women don't feel that way. But yeah, I was the same way. I did not want to lose the ability to move my legs and walk around and get up. And one thing I wanted, they had soaking tubs in the hospital where I gave birth, and I wanted to be able to get in and out of the tub. And so I didn't want to be attached to anything. And so I want to add that too, that water, getting in the shower and soaking in a tub, that can also be really supportive during the whole process. And one other thing, you're talking about, the surges and managing the surge, and then it goes, and then another one comes. Regardless of how long your labor is, there's this beautiful gift that nature gives us. Whether you do hypnobirthing or whatever type of birth that you have, it's this time distortion where for you as the birthing person, an hour will literally feel like 20 minutes. And for everyone else in the room, it feels like an hour. But for you, it'll feel like 20 minutes, or 20 minutes will feel like 5 minutes. There's something that happens where you get into this time warp and time does not exist as you normally experience it.
Ooh, that's good to know.
Yeah.
See, that's a hot tip.
Yeah. Yeah. So you can affirm that. You can affirm that like, okay, I want 1 hour to feel like 10 minutes. Like just keep thinking about that. Well, before you go into labor, as you're pregnant and preparing for it, just keep thinking about what you do want. And whenever a thought comes in, because I'm like you, Allie, I focus on, and now even being a mom, like all the bad stuff that could possibly happen. And so I have to keep working with my own mind. As soon as I have a negative thought of something I don't want, I immediately switch it. It's like Control-Alt-Delete on your computer. You get it out of the way and replace it with what you do want. Your mind can only focus on one thought at a time. So what you do is you have the negative thought, immediately replace it with a positive thought, and then keep repeating that to yourself. So you might have to do it 100 times over and over again, might have to do it every single day, but it's one tool that's really helpful. Keep thinking about what you want and replace negative thoughts with affirmative and positive thoughts.
Yeah, I mean, so much of when I'm working on story transformation and ownership with clients is we realize that, when we feel out of control with food, it's because we're out of choice. And I'm going to be doing next season's going to have a whole episode about control and choice and stuff. But when we're healing our story and old patterns, when we're in our story, it's always what we don't want. We're always, kind of preparing for what we don't want, which I think of in birth culture, right? It's like, okay, we don't want, like, we think of the worst case scenario versus when we emotionally want to heal, we have to take risks and we have to say, what do I want? I have to risk being satisfied and fulfilled rather than staying in this pattern. And so I think seeing that with my clients and how brave they are and seeing how that's helped me, it does help me realize, like, it has such a strong meaning for me to know that you have to be for something, not just against it.
Mm-hmm.
So I'm hoping that helps.
Yes.
And what you've said though is I've been talking to a lot of my friends who have done unmedicated births, and they have all said they said it just gets really trippy. They're like, I can't explain it, but like your body just takes over and time isn't time the way we think about it. So that's good.
Yeah, it's amazing.
Yeah. So I do want to get into kind of this transition into motherhood about what no one tells you. But before that, I just want to let people know a couple of choices that I learned about that I wasn't aware of. And we have one of our listeners, Jessica Gustafsson, she goes under Reverie_acupuncture. She shares a lot of cool stuff about birth. She's an acupuncturist. And she was talking about if you've been told your baby is breech, which OBs aren't trained in breech births anymore, even though it's a total form of normal, you can try moxibustion to flip the baby. And there's also the Webster technique. Again, nothing's guaranteed, but the research on moxibustion is actually pretty interesting. And I was like, oh, that's good to know. that those are choices. And then also for induction, doing acupuncture in the last 4 weeks. And I learned this from Jessica and Kara, who we've had on the podcast, who's an acupuncturist in Philly. But acupuncture in your week 36, 37, 38, 39, and 40, if you go that long, can really help fortify the body for labor and help the body do its own thing, kind of get out of the way of of your fear, I guess, or whatever's stopping it, and help tone the body for labor. So I just wanted to put those other choices in that I had learned about as I was going.
Yeah, I did acupuncture with my second, and he said, all right, I'm going to do this and this, and it's going to make your labor quick and easy. And I said, but I don't want to be induced with acupuncture. He's like, no, I'm not inducing you, but we're going to do it this way so that when it is time, it's going to be quick and easy, and 4 to 5 hours. And it was amazing. It was an amazing experience. So yes. And I also believe that I tried to get pregnant for a long time leading up to my first pregnancy, couldn't get pregnant, started acupuncture. And after 3 acupuncture sessions, I got pregnant that next month. So I think acupuncture is incredible.
Yeah, it definitely helped me. I mean, I went in to acupuncture and my cycles were all over the place. Western medicine told me I was in menopause, and Dr. Bonnie was like, her name's Dr. Ming Ping, but she goes by, Dr. Bonnie as well. I was like, you're not fazed by this? She's like, no. She's like, you're still young. And I was like, really? You think I'm so young at 13? But it was so important to have someone believe in me. And my cycles became regular. We had to do some herbs as well, but within like 6 months. And I know that was critical to me getting pregnant. What I love about acupuncture, and also what we talked about with Dr. Joy, which was episode 3 of this season, is really acupuncture, naturopathy. It's like, what do we have to do to just get out of the way so the body can do its thing? And I also feel like that's what hypnobirthing is about in a way. Like,
absolutely,
for this like cultural conditioning of fear around pregnancy and birth and labor and all these things. And how can we just make it is what it is and get people into their own experience and let the body do its thing, which again, I have a high belief system in. So what you think works usually does.
Exactly. Yeah.
So let's talk a little bit about this transition into motherhood, because it's been really interesting. A friend recommended this book by a therapist who talked about like how many women feel like they lose their identities. And then I talked to a couple of friends and they said that they just felt really empowered by it and felt more badass. And I was like, so everyone's obviously having a different experience, but what do you notice as someone who really supports, moms in their postpartum wellness that comes up that we don't think is going to come up?
Well, as much as we are so similar in so many ways, we are all also very different. We have our own experiences and our own points of view on things. And I don't know about you, Allie, but I've never experienced more contradictory information than I did when I was pregnant. And that just led into motherhood. I mean, you're going to hear so much information of the way things, should be done and what you should buy, from, sleeping habits to swaddling and breastfeeding or cloth diapers and carriers and all of that. And I find that one thing is to empower yourself, regardless of what your point of view is, leading into motherhood and that transition, is to really learn, talk to your friends, feel connected to your community, and really know that you're not alone in that transition and becoming a new mom. And then also take in the information and use what feels best for you, and then leave the rest. There's something so empowering and important about being able to own your decision about what you're doing or what you're not doing. The biggest one that people talk about is breastfeeding or bottle feeding. And I think when we get caught up in a guilt cycle, or when we look next door about what somebody else is doing or not doing, and versus comparing to ourselves, that's where we can get into trouble. That's where we can start to feel just feel disempowered, feel alone. And so really learning, listening, and then owning whatever it is that you decide to do. And that goes with pregnancy, that goes with your birthing experience, and into motherhood. But I found that was, I really struggled through that. And so now, as a mom of a almost 6-year-old and an 8-year-old, I can look back and, I'm working with moms too. I can see that more clearly now, and just really wanting women to own what they ultimately decide what feels best for them. And then for moms that are having their second baby, their third baby, or fourth baby, which if it's your fourth, you probably already know this, but specifically for your second, what worked with your first might not work with your second. So you might think like, oh, I've got this down. This is how I'm going to do it. This is how things are going to work. And then all of a sudden your second baby comes and you're like, oh, that doesn't work that well anymore. We can't do it that way anymore. And so I think that's why there is so much contradictory information out there, is because all babies are different. Even our own experiences are different as a new mom, as a second time or third time mom. And so you really have to just honor where you are in each moment and really listen to what feels best for you and what feels best for your family.
Yeah, I love that. And I work on, a lot of times when we're comparing ourselves to other people, it's an attempt at safety, right? Like, oh, maybe they know, right? Because I work on this. This is a big part of the competitor pattern that I work on with my clients, of why they, fall off track with their eating, is they compare themselves to their old bodies or to what the other person's doing. And the way that you really heal that pattern is you have to start to think about what metrics are really satisfying for you. And I think that's I don't think we're taught to recognize that that's what that comparison is about, right? There's, whether it's your first baby or fourth, like you said, each baby is different and there's so much uncertainty, right? And I think realizing that there's no right or wrong answer, right? Because that's when we tend to start to compare, well, what's the right thing to do? And it's everything is about context, which is why I love Chinese medicine, Ayurvedic medicine. We don't bring a lot of context, I think, in Western culture, right? We think it more in all or nothing. And so I just think that's important for everyone to realize and really think about satisfying choices. I love that you said that, Kristy. You have to own them, right? And okay, there's no perfect choice. Everything has a pros and con. And how do you go with the pro and then, work with the drawback and realize that you're not alone? That seems to be a big thing, is people think they're alone in how challenging this is, because we're a beginner, right? At each child is a new, I joke, it's like a new little startup, right? What's going to work with this one?
Mm-hmm.
And how do you suggest, because I think about when I was reading a lot of the research on, the qualities of a satisfying birth experience, they were saying that a lot of mothers will go into a birth experience saying, well, I just want a healthy baby. And they were basically saying then after the fact, they realized oh, wait, I wanted more. And I think that's one of the things that why everyone's so stressed is I don't know if we know that we can expect more, right? You can have a healthy baby, you can be healthy, and you can still have choices. So how do you recommend, is it talking to other moms? Are there certain resources? What do you recommend so that when we're in this new space where we're really just a beginner and learning how to mother this particular child and, obviously navigate a career if we have that or not, is there anything that you recommend to moms to ask themselves, or how do we own our choices, I guess is what I'm asking.
Yeah.
And knowing what's possible and how much we can ask for.
This is a really good question and a really, really hard one. And it's one that I still struggle with today as a mom. And it's something that I continue to work on. And there's so much I want to say about that, all kind of wrapped up in one. There's so many compartments of that. Number one, it takes practice to ask for what you need. Even just starting with that induction date, if you're 40 weeks and your doctor wants to induce you, to be able to say, you know what, I'd rather wait. And then to see what comes, what is your doctor going to say to that? Are they going to be supportive, or are they going to come back at you and say, no, that we really need to do this? There's that component of being able to have a conversation with someone when you are having different opinions. The other thing is that what I find to be the most challenging, and even in this line of work, and I don't know if this thought is going to lead to anything that's going to be helpful, or if it's just going to be a thought to let people think about and then come to their own conclusion. But something that I struggle with, and just in the line of work that I'm doing, is this whole idea around birth. And we had talked about natural birth and what natural birth means. And the cesarean rate is increasing. And number one, if you have an intervention-free birth, there can be judgments about that. I had one woman tell me that her nurse told her that she didn't have to be, you don't have to be brave, you don't have to be a hero because she didn't want an epidural. People might think that you're being boastful or that, you're bragging, or what are you trying to prove, is something else I've heard about someone that might not want an epidural. And on the flip side, someone that has a cesarean section might feel judged, might feel like they've done something wrong or that they couldn't do something. There's so much more to that conversation and so many more feelings and experiences around all of that. And I don't know what to do about that. I'd be curious to see what your thoughts are on that, Allie. But, I have just found that as I continue on my work, I've almost started to become a little bit fearful to even talk about cesarean sections. I put out a newsletter once a week, and I had talked about how to support yourself and your baby after cesarean, with probiotics or, vaginal swabs with the microbiome and all of this. And I had one woman respond to me. She was very triggered by my email and felt that she was judged after her cesarean and felt that I was doing that in my email, which was not my intention at all, but that was how she experienced what I was sharing. But I was just trying to support women after cesarean. But anyway, I just feel that there's a lot of sensitivity around all of this and the different experiences, and how if you've had a different experience than another person, how you might be seen or how that comes up in conversation. It's very sensitive.
Yeah, no, I mean, I talked about this actually on the episode with my naturopath, of saying that this other naturopath and acupuncturist had posted the research about women who go through IVF have higher breast cancer rates. And she was accused of shaming the women who went through IVF, with people saying, these women have gone already through all this, and then to tell them this. And I said in the interview, look, I think having my own business has taken years off my life. We've all made choices, right? Mm-hmm. That aren't quote unquote good. It's a tricky situation because I find it so frustrating, especially in the wellness community and with people that I know that tend to, anytime you have a different opinion, shut down that you're anti-science, when really the science and the emerging science, and that science is a process, not a destination. I mean, this is kind of a tangent, but I think we are getting so sensitive. I think we're in such a time of change that most of us don't have a huge capacity for uncertainty. And so everything that we're hearing, if it's not with what we've done, we're hearing it as you're wrong, instead of, hey, here's another choice. So I don't know what the solution is, but I do notice that everyone's so sensitive. And I agree.
Yeah.
I mean, part of even this, talking about hypnobirthing is, if this is not the norm, during our shower, we had kind of a joint shower / open house, and we invited, it was like co-ed, and my aunt, who I love, my aunt, she was like, Allie, just get the epidural. She's like, women do not need to suffer. And I was like, that is very true. And I have different metrics that I care about. I may end up getting an epidural, who knows? And I know me, and what will satisfy me is I have to try this way that is interesting to me and is calling to me. And I think the thing is though, is I don't feel better or for worse. Like, because I'm someone who just doesn't think there's a right answer about things.
Exactly.
So I can very much shrug that off. But I think when we're insecure about things, and if we don't know, like the breast cancer research, for example, like I'm someone who would want to know that so that I can figure out, all right, how do I detox from these drugs? What can I do to mitigate other risks, right? And also know that it doesn't mean you're guaranteed to get breast cancer, right? Like, I don't know, I'm kind of going off on a tangent, but I agree with you. I think the climate is so polarized and people are, I don't know.
You're right. There's a lot of sensitivity, and it just goes back to that point. I think kind of the overarching theme of our conversation today is to inform yourself, educate yourself, ask for what you want, ask for what you need, and do what feels best for you, and continue to strengthen that internal, I don't even know what that would be, but your internal knowing of what feels best for you, and just continue to take one step at a time in whatever direction that is, and for everybody, it's different.
Yeah. And I think your answer about like, it's a practice, right? Of knowing and owning your choices. Cause like we hired a doula, and she was saying like when she first started becoming a doula, that she really thought natural, or unmedicated, as we're calling it in this interview, unmedicated childbirth was the best. And then she saw in so many situations where the woman was getting tired and the epidural was what saved her from a C-section. And I was like, I love that, because that's context, right? That is nature, and life is dynamic. It's mysterious. There is no right or wrong. It's just, I kind of always ask myself, like, what do I want to experience? And like, what is this experience asking of me when I come out of the other side of it, right? It's not like, oh, what's right or wrong, I guess you could say. And of course, sometimes there are, like, if the doctor's like, look, your blood pressure is sky high, and we have to, and your baby's heart rate is descending. It's like, okay, there's a right choice there, right?
Exactly. Yeah, you've got to be flexible. You've got to be flexible. We talk about birth plans, but it's better to think of it as a birth preference. Your birth preferences, because in each moment, something can happen. You might have to change your mind. You might go in not wanting an epidural, and then after so many hours, you might be exhausted. You might not have slept for a day or two, and that epidural provides the relief that you need to be able to birth your baby. And so, yes,
comes bound to be able to pivot, right? This is why people like diets, right? It's like, okay, let me get on this plan, and plan is going to take me where I want to go. And diets don't work because your body is changing, and life is dynamic in nature. And if we don't have that capacity for uncertainty, we don't know how to pivot there, right? It's like, but this wasn't on my plan. And then we get stressed, and then like it goes downhill from there. And so I love your idea of like, we need to make it a practice of what we need. We need to make it a practice of figuring out what we need, right? And asking questions. And it's not a one and done thing. It's like an art. Yeah, it's a craft of discernment. I mean,
yes, it's a practice.
Yeah. And so I think that's important for people to realize, is even like, not only is there no right or wrong choice, but it's going to change. And so I mean, my big thing is Carlos is always like, Allie, like I beat myself up when I didn't have the information. Like I do something after the fact, and I'm like, oh, if I would have only known this. And he's like, when like, it's just this like very frustrating, like Buddhist, like, I'm like, I want to know sooner. And he's like, but you're never going to have all the information. And I mean, that's something that I've had to surrender to as well. But yeah, no, God, I want to like investigate this, like polarizing, like, you were trying to be helpful and someone took offense of it. It's like, don't you just want to have a conversation with those people? Like I do.
Yes, it's true. I did. I actually reached out to her personally, and we had a whole conversation about it. But yeah.
Did she feel differently once you conversed with her?
Yes. And that's where we realized that I had triggered in her what had happened after her experience, where a lot of her friends had given her a very hard time about having a C-section. And so I had triggered those memories had come up for her, and she felt upset. Because there's also like saying, okay, probiotics and vaginal seeding. Well, she didn't know about any of that back then. So maybe also in that, and this didn't come up, I'm guessing, I don't know if this is true, but and kind of thinking of, so by what I had said might have led to her feeling guilty, like, oh, I didn't do any of that. So did I do something wrong?
Yeah.
versus I'm empowering the pregnant women to, if they do have a C-section, I'm trying to empower them to do some things to help the health of themselves and their babies after that experience. So that's what's tricky, where you're trying to help somebody that have this, going to maybe have this future experience, but then other people that have had the past experience may not have done X, Y, or Z. And then they're feeling like you were just talking about in hindsight, wishing that you had known. And that's just life. Wait till you get to, we're talking about transition into motherhood. That's another thing, right? Like everything that you're going to learn later and wish you had known or done before, it's all part of it.
Yeah. Well, and that's the point of, I think, to your point, it's like, it wasn't the information you shared. It was like her assuming she was wrong now. And I think because we have fear-based culture, we have war-based culture with the body, we also don't recognize that the body's resilient. I mean, yes, there are certain things, and don't get me wrong, like I'm doing all the steps I can so that things can be as healthy from the get-go. And like my experience tells me, someone who like their chemotherapy was used in the atomic bomb, and I've had so many health issues, and I'm healthy now. Like, I think that's when we don't have those kind of conversations that you had with that woman, and when we just tell people that we feel shamed or triggered and we don't do our work to figure out why, and we need a helping hand to do that, we lose resilience. And so then we assume that everything is make or break, or there is a right or wrong, versus when you're resilient, you can always pivot, right? So it's just interesting. Our viewpoint like one of my clients in Truth with Food, one of her big takeaways was that like life is a lot more safe than she had assumed it was. And I was like, but that's because you're more resilient now. So if you sense it as more safe because you can recover in new ways. Do you know what I mean? It's like our own frame that we bring is what we bring to the data in our life. I don't know. I'm getting very existential and philosophical, but I think it's important for people to realize there's no right or wrong. You can always pivot. And as you transition into motherhood, and even in preconception, I think in getting ready for birth is learning to ask for what you need. If you need more information, if you want to know other choices, if you want to know where they got their data from, ask for it. It's important that you feel safe. And I think that's a big theme that's come up in this season is a woman's body needs to feel safe so that she can conceive with the right nutrition, removing the toxic load. And then you need to feel safe during your birth experience. And you can do that through choice, like we've talked about today, a lot of pain management that, Kristy has added to. And if you're someone who likes evidence-based care, knowing the information can make you feel safe. So I think that's the big theme of this season. Kristy, thank you so much. Is there anything that I didn't ask that you think is important for people to know?
No, I think that was just such a beautiful summary of kind of a closing for our conversation, and then all of the ones that you've had in this series that you've done, which thank you so much for doing this series. I think just getting this information out there is so wonderful. And I'm so grateful for you for doing that. Of course, there's always, I could talk about this stuff for hours and hours. There's always so much more, especially, around transition into motherhood and what no one tells you. The one thing I'll add, just to kind of end on a funny note, I think it was Chrissy Teigen posted on Instagram. It could be her. It was maybe somebody else I might be misquoting, but somebody, I think it was a celebrity, said, "No one ever told me that my baby would be the only one going home in diapers, because you too will go home in a diaper."
She is so funny.
Yeah. So I think that's something no one tells you. As much as you'll be caring for your brand new baby, with a vaginal birth or cesarean birth, you will also be caring just as much for your pelvic floor or your body as well after you give birth.
Yeah, no, that's a good point. Yeah, and there's obviously so much more to cover. And you have your podcast, Pure Nurture, that people can get. I know you did too, because I listened to both of them, episodes on the pelvic floor. These body parts that are so internal, we're not like taught that they matter. But where can people find more about you in addition to your podcast, Pure Nurture?
So everything I have is at purenurture.com. My book, the podcast. I'm working on an online school, online health coaching for pregnant women. So if you are pregnant, planning on getting pregnant, or if you're a new mom, my podcast is full of episodes just like this one, talking about all the different aspects of pregnancy. Even like Allie, you had said you met someone your teacher told you about orgasmic birth. I interviewed the creator of Orgasmic Birth and the producer of the documentary Orgasmic Birth. So, like if you want to take a deep dive into any of these topics, I've got lots of great conversations with people doing a lot of work in this field of pregnancy and postpartum wellness.
I love it. I think I'm just going to have to watch the documentary to challenge my side eye.
Yes.
I'm not a full convert yet.
It's amazing. I met somebody, her mom had an orgasmic birth with both her and her sister. And I was like, oh, it's just amazing.
Yeah. My mind's going to file that under genetic improbability, but I would love to be proven wrong.
You never know. And remember, Allie, the power of the mind. Just keep affirming and believing that you can have an orgasm during birth.
Yeah. Except my mind is inherently skeptical. So I don't know. I'm not going to write it off, but I'm also going to plan for some other provisions.
Yes. It's so good to be prepared.
Yeah. And then watch it not matter.
Exactly.
Thank you so much for being here, Kristy.
Thanks, Allie. This was so fun.
Thank you, Health Rebels, for tuning in today. Have a reaction, question, or want the transcript from today's episode? Find me at allieshapiro.com. I'd love if you leave a review on Apple Podcast and tell your friends and family about Insatiable. It helps us grow our community and share a new way of approaching health in our bodies. Thanks for engaging in a different kind of conversation. And remember, always, your body truths are unique, profound, real, and liberating.